Okay. Hi, everybody. You can see the screen, I take it? You can see the PowerPoint? Good.
Yeah.
Just get you guys in gallery. Sorry, I was just trying to eat my lunch in between classes. Okay. So we're talking about agoraphobia today, but before we do that, I just wanted to get you up to speed on the next exam, which is, the first exam. It will be Friday, February 26th. So that's 2 weeks from today. And it will be on everything we cover up to then. It will be 25 multiple choice questions. I'll try to keep the prompts shorter questions because you're going to have 33 minutes to take it. And people who have time and a half will have 50 minutes to take it. And then people won't have to reschedule different times to take it, things like that. And I'll be there for questions. You'll log on just like you do every class, and then I'll just watch you on these cameras. You'll have to be on camera to take the exam, and you'll get on the exam just like you would get on a quiz, except there'll be a time limit and it's not open book. And I'll just monitor you from here, as best I can do. I will post a study guide a week before. I suggest if you want to study before then that you use the PowerPoint slides as a guide. I will make sure those are all posted. Remember to do that. And just so you know how much each exam is worth 20% of your grade. The quiz average is worth 20% of your grade. And then that's what I like assignments that there are 2 of are worth 10% of your grade together. And class participation is 10% of your grade. The final exam is not going to be cumulative. It will just be on from the second exam to the final exam date. And they'll all be the same exact format. Okay, any questions about that? About the exam? Nope. I don't, let me get my text window open, my chat window. Let me move anything. Okay. All right. All right, so we talked about panic disorder last time, and panic and agoraphobia often go together, right? And one of the reasons is, well, can somebody describe in their own words why someone with panic attacks might develop agoraphobia? I mean, it kind of says it on the screen, but can somebody describe it in their own words?
Well, couldn't someone have a panic attack with agoraphobia since they're like scared to go to places that they feel like difficult to escape?
If in the case of a panic attack, right? Yeah. So what would make it particularly excruciating if you did have a panic attack? Anyone?
Well, when you have a panic attack, you kind of already do feel like you can't like escape, or you feel like stuck sometimes, like in your body a little bit, like the emotions you're experiencing. So I feel like added on with agoraphobia is like the symptoms of a panic attack just like intensified.
Right. So you're so afraid, and then you're out somewhere where you feel extremely uncomfortable getting help, and extremely embarrassed by the symptoms. And someone in chat said with both disorders, you would try to avoid situations. Yeah, I mean, if the panic disorder gets so bad that you're fearing the next attack so much that you can't leave your house, it can lead to agoraphobia because of that. So agoraphobia is fear of being in places where it would be difficult to get help, um, difficult to escape. And, people can, when people are extremely scared and their um, sympathetic nervous system is that activated, bladder muscles relax. So people can lose continence, they can pass out, they can throw up, and all those things are pretty embarrassing to do in public. Um, so that's why people don't want to go out. They also just, have a terrible feeling of impending doom in certain situations. Okay, and sometimes it reaches, in agoraphobia, the fear sometimes reaches the level of a panic attack and it sometimes doesn't. So panic disorder and agoraphobia can occur together and often do, but they don't always. You can have one or the other. So some people have panic disorder and still do go out and do everything. It's just with considerable discomfort, right? And some people with agoraphobia stay home and have considerable discomfort, but not to the extent that it reaches the level of a panic attack. So in the DSM, it used to be coupled together. You had to say when you diagnose someone whether it was panic disorder was with or without agoraphobia, and you don't have to do that anymore. So I wanted to ask you guys, what other disorders do you think panic disorder and agoraphobia, whether they're together or alone, what other disorders might they be comorbid with? What can you see people having in addition to that if they had panic disorder and or agoraphobia? So it's not going to be, when you're doing differential diagnosis, you don't diagnose someone with a disorder and then a milder form of that disorder. So say you wouldn't diagnose someone with, say, PTSD and then also acute stress disorder, because acute stress disorder is PTSD that doesn't last more than a month, right? So you don't do that. But if there's another disorder that exists, on its own that you would diagnose someone with, if they didn't even have panic disorder or agoraphobia, then they'd be considered comorbid for those two disorders. So can you think of others that people with these two things might have?
Claustrophobia.
Claustrophobia, and that's a form of specific phobia, right? So, or a simple phobia. It used to be called simple phobia. Now it's a specific phobia, I think. Um, yeah, so if somebody has a specific phobia, that would lend itself, to agoraphobia too, if it's something that they would encounter often leaving the house, right? Can you think of other ones?
I was gonna say PTSD, but anxiety.
Yeah, well, PTSD is, well, it was considered one of the anxiety disorders, and now it's in its own category. It's one of the trauma and stressor related disorders, and somebody with PTSD might have trouble leaving the house, right? So, say somebody suffered a horrible assault of some kind, they might have the symptoms of PTSD and, you know, above and beyond the normal symptoms of avoidance that are always included in PTSD, they may also, above and beyond that, have enough symptoms of agoraphobia, that they be diagnosed with that too, if they're just not leaving their house, right? What other disorders might make it hard to leave the house? Oh,
Social
Bryant,
anxiety.
sorry.
Would depression be one?
Yeah, depression. It can get, you know, if you say you have agoraphobia and you can't fulfill the roles in life, or you can't kind of go after the dreams in life that you wanted, that can get very depressing, right? So if there's, if the dysfunction caused by any disorder, um, dysfunction caused by any disorder really could cause some depressive symptoms. Oh, and a couple people have said social anxiety. Yeah, so social anxiety disorder is almost a type of phobia. It used to be called social phobia. I still like to call it social phobia. I don't know why. It just strikes me as more accurate, because it does, because everybody has well, not everybody. There's those people who are just know what to say in every situation and are the life of every party and super popular and all that. Good for them. But then, us mere mortals, most of us have a little social anxiety in some situations, right? And even those, perfect party attenders might feel a little weird and awkward with, say, like a professor or something, or like their stepfather or stepmother the first time they meet them or something, and hopefully they don't meet them after the wedding, but you know what I'm saying. Yeah, so but anyway, somebody with social anxiety might get so severely afraid of the scrutiny of others that they stay home and develop anxiety. And someone said obsessive compulsive disorder. Yeah, if you're so afraid of germs, if your obsession is fear of contamination, it's going to get harder to leave your perfectly controlled, perfectly sterile environment, right? So yeah, there are a lot of things that could co-occur with, the list is pretty, it's not endless because there's only 300 something, just I think it's 327 disorders in the DSM-5 or something. But there's a lot of them, right? Okay. All right. So here are the actual DSM-5 criteria for agoraphobia. And I just want to point out that criteria, that's the name for the symptoms. It just means the symptoms that are kind of the qualifications for a diagnosis, right? And that's the plural. Criteria is the plural, and criterion, O-N at the end, is the singular. And you can remember that because O-N is part of one. It looks like one at the end of it. Okay, so features of agoraphobia include marked fear or anxiety about two or more of the following. So this is where it gets more specific, okay? Because we kind of think of it as just not wanting to go out. But they do the DSM kind of narrows it down to very specific fears: public transportation, open spaces, enclosed spaces, standing in line or being in a crowd, being outside the home alone. So it can just be like public transportation, you know? I mean, it has to be one other one too, but say it could be crowds and public transportation. Well, my life and some of your lives presumably don't involve a ton of public transportation and a lot of big well, nobody's does right now. But even pre-COVID and post-COVID, a lot of people's lives don't involve a ton of public transportation and big crowds. So a lot of us might not be diagnosed, but would be if we were in a different environment, right? So it's, there can be milder seeming cases that might not even get diagnosed. And then there are some people who can't be outside the home alone at all. So again, there's a big continuum of severity, even within the diagnosis. So we've been talking over and over again how one of the things that distinguishes just regular problems from a diagnosis, some of the things are severity, duration, the frequency with which somebody has a symptom, how deviant it is, how dysfunctional it is, how much distress it causes, right? And so some of this is going to depend on somebody's environment, some of these criteria, right? Because it's not going to cause a lot of distress and dysfunction if someone's life doesn't involve any public transportation and they live somewhere where there are no crowds, like way upstate in Maine or something, Okay, the individual fears or avoids these situations due to thoughts that escape might be difficult or help might not be available in the event of getting really bad symptoms or really embarrassing symptoms. Okay, so they either fear them or avoid them. So people can have agoraphobia and still go do the thing they're afraid of. So sometimes they stay in, and sometimes they endure the intense discomfort and even have panic attacks, but still do the thing. And that's not fun. Neither is fun. So the situations, it says almost always provoke fear or anxiety. It seems like always to me from what I've seen. They're either actively avoided, require a companion, kind of like a chaperone, or they're endured with intense fear or anxiety. And a lot of times, someone with agoraphobia has like that one person, usually a family member, that they rely on to go with them to appointments, to places they don't like to go. And does anybody have like a symptom where they really don't like one of these situations and maybe gets anxious or irritable in one of these situations, but not to the extent that it would be an agoraphobic symptom, do you think? Because severity is a big part of this. There's a lot of people anybody who doesn't like crowds here? I mean, you're kind of young. I mean, it's like a party, right? But is there anybody who doesn't like huge, loud parties? I can't see everybody, and it's not letting me click screens. Oh, here we go. Could separation anxiety be another disorder with agoraphobia? Yes. Yeah, if somebody relies on someone who stays in the home a lot, somebody who's immobilized for some reason and has separation anxiety with that person, it's going to be really hard for the person with separation anxiety to leave the home. And it can snowball into agoraphobia. All right. How about closed small spaces? Anybody not really psyched about those? Okay, just a couple people. How about that new trend to the TikTok trend to put your bed in a closet? Have you guys seen that? Would you do that to get more space in your room? How many of you, I mean, say somebody say that, I don't know what say you thought it looked really cool or something and you really needed the space in your room, would you do that? Would you be comfortable with that? Raise your hand. If you had to, like, would you be okay with it? How many of you would be uncomfortable sleeping in a closet? I wouldn't really like it either. I don't think. Yeah, I mean, sometimes it's like cozy to be in a small space. I guess it depends if you're alone too. Yeah, so, but unless you really, you have to get so uncomfortable and avoidant of it that it's a severe symptom for it to really be a symptom of agoraphobia. And again, you have to have more than one of these fears. It has to be two or more. Okay. And the fear or anxiety is out of proportion to the actual danger posed by the situation. Like maybe, like if you, if you were at the Capitol building on January 6th and you didn't have fun in that crowd, I wouldn't diagnose you with agoraphobia, right? I'd be like, yeah, I understand. I'd be more likely to diagnose you with PTSD if you were there, right? I'm not going to say you have agoraphobia because you were intensely uncomfortable there during the, uprising. Okay, the fear, anxiety, or avoidance is persistent, typically lasting for 6 months or more. So there's the duration criterion. There it is again. It seems like 6 months is a popular one for some of the anxiety disorders, right? What if somebody was like that for 5 months? Should they not be diagnosed? What do you think would happen if you say you're the psychologist and somebody comes to you and has had these symptoms since, let's see, I don't know, September. Yeah, since September. What would you diagnose them with anything? Like half of you. Oh, everybody's back. Okay. I guess my internet connection's unstable. It actually just told me that. Okay. I think everybody's is. So it has to cause, what does this one mean? What's the D word for criterion G? There are a couple D words in that one. Do you have criterion G on your screen?
Is it distress?
Yep, one of them's distress, and there's another one in there. I mean, it doesn't start with D in there, but you can.
Avoidance.
Well, avoidance is there, but I'm looking for a word that starts with D. That's one of the D's that distinguishes just regular problems from a disorder. Remember, there was like distress, deviance.
Would it be dysfunction?
Yeah, dysfunction, right? Impairment in important areas of functioning. So there can be a medical condition present, but you wouldn't consider the avoidance part of agoraphobia if it was warranted. You know what I mean? If somebody's afraid to leave their house because without oxygen they'll die, that's different than if somebody has, a tremor disorder and they don't want to leave their house because of it. And it can't be better explained by the symptoms of another disorder. So that's called differential diagnosis. Differential diagnosis is when there are two disorders that it looks like somebody might have, and you wouldn't diagnose them with both because they're too similar. You have to pick which one they have, right? Like maybe agoraphobia and social anxiety. If it isn't obvious, they have both, right? You might have to pick one or the other, right? So they're just telling you, make sure you're not diagnosing both unless you have to. And these are often right at the end. You're going to notice over the course of the semester, you're going to see distress, causes dysfunction, isn't better explained by a medical condition, isn't better explained by a different disorder, right? You've seen that time and time again, and you will all semester. Okay. Let me just see where. Oh, I was just trying. Oh, everything flew around just there. Is the slideshow showing anymore?
No.
No. Okay, because I want to show you a video. Any of you guys watch Shameless? I think I asked you this last time. A couple people. I can't believe more of you don't watch it. I think there's like a zillion seasons now, right? Somebody was telling me. I've only seen like 2. But this is one of the seasons I saw, and Joan Cusack plays Sheila, who has agoraphobia, among other things. And you can try to see if you can come up with some other diagnoses she might have. And I was so happy to find this on YouTube because it kind of captures a bunch of different scenes that I really wanted to show you guys. And I was like, I'm not going to have time to pull this together. So anyway, you can see this now, right? You can see it says Shameless Sheila. Okay. Cool. Let's watch this.
Hi. I'm here to help Karen study for a midterm.
Okay. You have to take your shoes off.
What?
I'll get you a plastic bag. She's got this thing about people re-injuring the house. Agoraphobia. Oh, good. Mom, we have to wear our shoes. There's a glass on the floor. Quiet here. I have not been out of the house in 5 years.
5 years.
I can't. I have this overwhelming fear. I've got agora. So I'm sorry, Frank. I know I'm a little nutty about shoes, but feet. Oh God. They have to
Sorry,
be.
Sheila. Sorry.
I am off to the store. Does anyone need anything?
Store? I thought you had iced in a basket.
I have a feeling that today's gonna be the day, Mom. I think so too, sweetie. I think so too.
All right, well, give me a case of old style tall boys, will you?
Okay. Okay, so, Mom, just 1 foot in front of the other. And I will open the door. Open the door, and I take a step out.
Sorry.
I'm right here. You want a drink? I've got a lot of booze, no mixers.
Cup of coffee would be great. Why don't I make it?
Oh, don't mind me. I accidentally took 3 of my pills instead of 1. This is the dress that I will wear this afternoon. And it will protect me like this house protects me. This is the dress. Today is the day. And the day is good.
You look nice. Where are you pretending to go?
I am ready.
You're coming, Mom.
Yes, I'm coming. I've got my purse and my gift, my gloves, and my selective serotonin reuptake inhibitor, and my monoamine oxidase inhibitor, and I have my anti-anxiety disco biscuits, and I am ready to go. I am really ready.
It's parents' night at school tonight.
Right. I will be there, sweetie. I've been working towards that. That's right. I have it right on my calendar. I circled it. I've just been busy, but I will be there. Sweetie, I'm gonna be there. Okay? I have a session today. I'm gonna have a breakthrough. I can see.
Keep laughing and it will slit your throat while you sleep.
I'm thinking Indian. So let's go get some curry.
Excellent. And now, how about we go find some fresh chicken?
Ooh, yes. A yummy tikka masala.
You're doing great, Sheila.
Thank you. You know, I feel terrific. It's really kind of nice to be out and about.
Do you see any fellow shoppers?
Oh, yes. Hi.
Good, Sheila, good.
Oh, that wasn't so bad. Okay, now this one's coming a little bit close.
Well, sometimes when we're out and about, people shop for some of the same thing. And they enter our space for a moment.
Yes, that's happening.
Say hello to her.
Hello. Oh, that wasn't so bad. That wasn't so bad at all. She seemed really nice. Okay, so, oh God, wait.
Time to check out and head outside.
No, we just started and I still need vanilla and raisins and peaches. I need to get some peaches.
No peaches, Indian food.
No, there's peaches.
Concentrate.
Oh God. Oh, no, I can't do it. I cannot stop and make it stop.
Grammarly can help you write quickly and
All right. Okay, so what are your comments? What criteria did you see? Are there some other symptoms she may have had of other disorders? Haley?
I noticed that when she was with her therapist or the lady that was in her house, was she using exposure therapy to like get her to, with the virtual reality, to go into the store? So was that was kind of exposing her to the environment, I guess.
Yeah, and Yeah, exactly. That's virtual reality therapy. And it lets people do things that they couldn't ordinarily do and do like systematic desensitization when you slowly get closer and closer to the thing that you most fear. It's particularly good when soldiers have PTSD because you can't really recreate um, combat in a therapy session, and you can't recreate assault and stuff like that, but you can, with the computer program you can make certain things happen that it usually go it's usually driven by the comfort of the client. Of course, this therapist was making a screwdriver and drinking at her house while she was doing therapy, so I think maybe she pushed her a little bit, like she could have stopped and, taken a rest before she got a peach, right? I mean, before she checked out, right? Any other things you noticed? Uh-huh, Emily?
Maybe she has like some form of OCD because like whenever anyone came in the house, like they had to take their shoes off, and then she had like a lot of her furniture covered in like plastic wrap or something.
Yeah, the doorbell, the doorknob. Yeah, she definitely had fears of a few things, right? Like dirt. What else? What did she freak out when she saw?
Frank's feet.
Yeah. Yeah, she's not a fan of feet, right? So dirt, the shoes have to come off, feet, all disturbing to her. So she has obsessions, fears about them, and she has compulsions related to the fears, like keeping things covered, putting the shoes into plastic bags, things like that. How about what was her? Oh yeah, Yasmin.
I was just gonna say she has like stuff that she's like obsessed with, like the obsessive compulsive disorder or whatever, like how she like tied herself with sheets to the house, like even just being tied to the house or like having the comfort of knowing those sheets are like connecting to her to the house, like
Right.
makes her feel like safer, or like even putting on the dress, like since it's from her house, she's like, or from her closet, it like gives her a comfort that it's on her.
Yeah, and she actually did make it out of the house that time, right? So what was the big motivator? What actually got her to do it that time? Remember why
Are you
she?
talking with the sheets?
Yeah,
I know that the little boy Liam or whatever was outside at the gate.
yeah,
She like had
yeah.
to
Her little, is that her grandson? I can't remember.
It's Frank's or son or something. Or
Okay.
the Monica's son, yeah.
Okay, I can't remember
There's so
everything.
many people.
Yeah, so but she ends up taking care of him, and she's totally loves him, and so he got out of the house, and that was what motivated her to do it. So she took drastic measures and tied herself up with sheets and attached them to the house so she could do it. She didn't feel good, but she had to do it for the child's safety, right? um What about when she first tried to leave the house in the very beginning, right? And she's at the door. What's the first thing that kind of shakes her up when she's at the front door and she closes it behind her and she's going to the store and she's going to buy Frank some tall boys or whatever?
The noise of the truck going by.
Yeah, the loud noise really got to her, right? So there's a bunch of things that could be associated with that, right? So when people are when they get sensory overload really easily, there are a lot of things that can cause that. That can be PTSD. Um, and there are medical conditions too. People with fibromyalgia are much more likely to get overly, sensory overload. So and you still can be diagnosed with agoraphobia if you have fibromyalgia and are overly sensitive to environmental stimuli because of it. That if that makes you stay in, you can still get diagnosed with agoraphobia. And she could, you know, people can have PTSD and agoraphobia, like we talked about. Let's see. And how long has it been since she left the house?
5 years.
5 years, right? So, and that happens to a lot of people. I think, I don't know if we're doing body dysmorphia. We probably are. But sometimes I show a video of like 3 different women who have body dysmorphia. When people have a real, but a small, real, or an imagined flaw or defect that gets totally blown out of proportion. And a lot of people attempt suicide because of it. And a lot of them end up not leaving the house because of it. So you can have agoraphobia on top of body dysmorphic disorder. What about the time she was getting all, oh, are we, no, we have till it's 1:04, right? Okay, I thought I went over. What were some of the medications she was taking to be able to go out? I don't know what that event she was going to was, but she said, I have my gloves on, I have and she named a bunch of medications she had taken. Some of them we've talked about, like types of medications. Anybody remember?
I don't know if I think it was serotonin, either reuptake blocker or just serotonin blocker.
Yeah, she had her selective serotonin reuptake inhibitors, her SSRIs. And then another one was her monoamine oxidase inhibitor. Those are MAOIs. And then she called it her anti-anxiety disco biscuits. I think that was probably some kind of benzodiazepine, like Xanax or Klonopin or something like that, because people do abuse benzodiazepine. Oh, if you guys sorry, I actually watch TikTok. It's almost embarrassing. I have 5 teenagers, you know, so if I want to understand them, no, I actually, yeah, I have twins and my husband has triplets, and his are 15 and mine are 13, and their birthdays are March 2nd and March 3rd. Isn't that weird? So mine are going to be 14 and theirs are going to be 16. So anyway, you guys know who Fleetwood Mac is now, right? If you watch TikTok, or maybe even if you don't, I have no idea. But anyway, so Stevie Nicks, she was addicted to benzodiazepines for like decades. Yeah, and they're calming, you know, that's why people like them. And then, but you have to keep taking more and more for them to have the same effect. Anyway, and that might be, have you seen her talk? Yeah, she sounds like she's on benzodiazepines. She sounds really chill, you know, but almost like half asleep. Anyway, so she's on all those things, and I'm like, is that safe? I didn't think you could take SSRIs and MAOI inhibitors at the same time because they both alter serotonin. And it turns out that when they really recommend that you don't, because it can cause serotonin syndrome. So I looked up what serotonin syndrome is. And basically, it's, you know, it's when you have too much serotonin in your brain, and that can cause, you know, the right amount is great. A deficiency causes depression and suicidality and anxiety, but you don't want so much that you get mild symptoms like shivering and diarrhea, all the way up to severe symptoms like muscle rigidity, fever, and seizures. And that can cause death if not treated. So, I hope, you know, and then with the anti-anxiety disco biscuits, assuming that it was benzodiazepines, the combination of that with either of the serotonin enhancing medications would just enhance the action of the benzodiazepine. So you just get more sedated, usually not to a dangerous level. Let's see, is there a way you can accidentally have too much? Like, it says over microdosing. So like overdosing, or you can like, I guess if your doctor prescribed too much, or if you took more than is prescribed, some people add, you know, a small dosage, a micro dose of like a benzodiazepine to somebody's SSRI if they're still anxious after they've been taking the SSRIs for a while, and that won't cause anything. You can always look up, you know, on, you know, rxlist.com or whatever, what the maximum dosage is for a person. Make sure you never go over that. I mean, take your medication as prescribed, but you know, if you take 2 by mistake and you're like, uh-oh, what's gonna happen? You can look it up. But yeah, yeah, you can have too much, like if somebody, you know, if you go to one doctor and they prescribe one SSRI and then you go to another and you start taking them at the same time, it's not a good idea. You know, just do ones, you know, tell your doctor. Yeah, I mean, it's not that dangerous in a normal dose, like unless you are taking 2 at a time, which nobody would prescribe. So she just has like an arsenal because she's been to the psychiatrist so many times, you know. Anyway, so I guess I'll stop there. Hope you guys have a good weekend.
Thank you.
Take care.
Thank you.
Thank you.
Thank you.
Bye.
Thank you.
Thank you. You do the same.
Bye. Take care.